Okay, we're going to talk about PPE. That's your personal protective equipment. So Daisy has everything out here ready to go. First, she's going to don her gown or put on her gown. This is her type of protective attire. And if you notice, this is nice and long. It goes past her knees. She's got the knit cuffs that come all the way down. And then the gown goes up high on her neck. Protective attire needs to be changed at least once daily, or if it becomes visibly soiled. So she's putting that nice and around, and you notice that she's tying in the back. You always want to tie it in the back because the front of yourself or your protective attire is going to get contaminated throughout the day, so we don't want the tie in the front. Next, we're going to put on our mask. So when you put your mask on, you want to make sure it goes over your ears, and you want to have the little bend part over your nose, and she's going to fit that right over her nose. Perfect. Now we're going to do eyewear, which eyewear could be goggles, a shield, all different types of eyewear. Perfect. So we'll look at that from the side. Great. All right. So last on is going to be gloves. So before we put gloves on, we're going to do some sort of hand hygiene. She's going to use hand sanitizer, or you could wash your hands. So any type of hand hygiene before you put on gloves. Make sure that that hand sanitizer is rubbed in really good before you attempt to put gloves on, because it will not work out in your favor. So make sure it's nice and dry. Perfect. All right, now she's going to put her gloves on. All right. Now those gloves are going to go up and over that gown. Your gown needs to be tucked into the glove. Great. Perfect. Now you always want to look at your gloves and make sure there's no holes or anything in them before you start to work on your patient. Perfect.